More and more people have been asking to mix and match COVID-19 vaccines. That's according to Public Health Madison-Dane County, particularly people who got the Johnson & Johnson vaccine.
Our Jamie Perez spoke with public health officials and doctors about this. Jamie, why is it happening and what are they telling people about mixing vaccines?
All right, well, there's a number of different reasons that they're hearing from people about why they want to mix vaccines. Part of it is seeing what's happening overseas in Europe. Some of it has to do with fear over the variants, and some is just misinformation.
We've worked through many problems throughout this pandemic, and the story continues to unfold.
Starting to see an uptick of folks that have maybe received one type of vaccine coming into our clinic wanting a different type of vaccine.
Public Health's COVID vaccine deputy Tess Ellen said it's mostly people who got the Johnson & Johnson vaccine who now want either Moderna or Pfizer.
Concern over Delta variant, and they're wanting some extra protection.
Dr. Jim Conway at UW Health said he's also hearing about more and more people doing this for a number of other reasons.
The mix and match thing is really, again, only being done with the Chinese, the Russian, and the European vaccines because they're just not as powerful. And so the idea is, can you boost them by adding an mRNA vaccine?
In other countries, studies are being done to test the safety and effectiveness of mixing the AstraZeneca vaccine with Moderna or Pfizer to boost immunity. But Dr. Conway said those studies do not apply to the effectiveness of J&J's single shot.
People need to understand that when the Johnson & Johnson vaccine was studied, they studied 1 dose versus 2 doses. So, I mean, they did the same studies that Moderna and Pfizer used. They decided that they did need a second dose. Johnson & Johnson decided that they really didn't need that second dose, that they got nearly as good an immune protection with that single dose.
Doctors are also saying that mixing vaccines puts you at greater risk of experiencing side effects.
Without good scientific data that shows what the side effects are when you start mixing and matching these things, I don't think any clinicians should be comfortable going off script and starting to give boosters unless we have very strong scientific data that it's safe to do so.
And the CDC doesn't recommend this either.
There's no data that we have that would indicate any recommendation for mixing and matching series at this point in time.
Could mixing and matching happen eventually? Doctors say certainly, but we need to let science, research, and data decide when it's safe and effective to do so.
Now, they also pointed out that this is still a global pandemic, so every dose that is used inappropriately here, that's a dose that could be used in other places for those who need it.